Welcome and happy holidays, Medicare curious listeners. Today we are diving into a topic as essential as your morning coffee and as complicated as setting up your smart TV. Medicare.
Ooh, it might sound complicated, but on Queer Money episode number 571, brought to you today by Capital One, we're here to make it all make sense, minus the bureaucratic headache.
Exactly. So let's break it down and get you Medicare savvy in no time. Now, on with the show.
All right, it's exciting, huh? Talking about Medicare, yay us. So, just for those of you who aren't familiar, we're going to dive into these briefly. We're not going to go too in depth. We are going to dive in later episodes, dive into each of the parts of Medicare more in depth and give you more concrete information. This is just a high level overview. But for those of you who aren't familiar with Medicare, it's divided up into four main parts: Part A, Part B, Part C, and can you guess? Part D.
Well, it's the government. I wouldn't be surprised if they had like a seven there or something like that.
Each part provides specific types of coverage to meet different healthcare needs for different folks. So we're going to dive into that at a high level, and then in future episodes, go in more depth. So, David, you want to kick us off with Part A?
Right. So Part A is technically called hospital insurance. So when you ask the question, what does it cover? That's kind of what it covers, right? It covers inpatient hospital stays, skilled nursing facility care. So say, for example, you need a short hospital stay after a surgery or something like that, hospice care, and then in some cases, home health care, but that part is rather limited. So who pays for Part A? Well, pretty much every one of us who has a job and pay taxes, because most of us who have had a job and pay taxes, we will have Medicare taxes taken out of our paycheck. We will have needed to have worked and paid those taxes for a minimum of 10 years in order to qualify for it. Keep in mind that there are some deductibles and coinsurance costs with Part A.
Exactly. So Part B is otherwise known as medical insurance, and again, that kind of covers what it covers. That's doctor's visits, outpatient care, preventative services such as screenings or for flu shots, medical equipment, for example, such as wheelchairs or walkers if you need one. And then, of course, it also covers mental health services. So who pays for that?
This is a
Well,
little more complicated.
this is a little bit more complicated. Yeah. Those who sign up for Medicare Part B pay a monthly premium, and that's also adjusted based on income. Then there's an annual deductible, and patients pay 20% of medical bills as a coinsurance for for most services after meeting the deductible. There's no out-of-pocket max, unfortunately, so that's something to kind of watch
Yeah,
out for.
that's kind of scary.
For Medicare Part B, the health insurance industry is what it is. So that means that you could pay tens of thousands of dollars towards major medical expenses that won't be covered by Medicare Part B. So it's important for this very reason to make sure you have an HSA or a health, otherwise known as a health savings account, or enough money in your emergency savings account to cover unexpected medical expenses. And for that, of course, and as always, we highly recommend opening up a Capital One 360 account. It's super easy to open online. Capital One supports the LGBTQ plus community all year round, not just during Pride, and they typically offer some of the best rates available. So your health insurance emergency savings money can kind of grow on top of itself.
Yeah. So Part A and Part B are kind of government run. The Part C, the third piece here, is called Medicare Advantage. Now, many of us probably have heard about this because we see these commercials on TV as well. Part C is basically a combination of Part A and Part B. It also includes sometimes parts of D, but what you're seeing here is that this is typically run by outside companies, right? This is managed by a private insurance company that is approved by Medicare to actually run this. It also often includes additional parts of overall health care, such as vision, dental, and hearing.
What?
Yeah, exactly. Some of the key features here is that you typically will use a network of providers similar to an HMO or a PPO that you may already have or had while you were working. The premiums on this do vary by plan. So you're going to almost pick and choose a company and their plan and their pricing when you're looking at various plans that are available to you in your state. And there is an out of pocket cost cap here on Part C, which is nice. As John mentioned, in Part B, there isn't that out of pocket cap. So, one of the advantages of Medicare Advantage is it does cap the amount of money you would have to pay out of pocket.
Then Part D is covers your prescription drug expenses. So what does it cover? It helps cover the cost of prescription medications, which includes many vaccines and other shots. That is, of course, until RFK gets his dirty mitts on our health insurance coverage. Who pays? Well, at the end of the day, you do.
Right?
Most drug plans charge a monthly fee, and they vary by plan. If you have Medicare Part B, you pay this as well, in addition to the Part B premium. If you have Medicare Advantage that David just talked about, or Part C, or Medicare cost plan with drug coverage, the monthly premium may be included in an amount for that drug coverage. So that could be sort of in there somewhere, but you're paying for it. And then monthly premiums, copays, and coinsurance are often attributable to Medicare Part D. So there are some additional expenses that are tacked onto that very often. So plans vary in cost and specific drug coverage from plan to plan. So you have to do your homework. Unfortunately, it's not easy, and I think that's by design.
Yeah, it almost seems to me if you have two choices. You do A, B, and D, or you do C, and you kind of get almost holistic coverage on those. Obviously, John and I are not Medicare experienced individuals or experts. For those of you who are on Medicare and have some experience, feel free to comment or let us know some of your experiences.
Anecdotally, I will share that my parents, David's in-laws, are on Medicare Advantage, and they absolutely love it. They have no complaints about it, and they're always surprised with how little they have to pay, which probably means that we're paying for it, but
it is the
it is
government.
the
So
government.
roundabout way we are paying for it. One of the things that we did talk about there in Medicare Part B was there was not an out-of-pocket maximum. Well, that is actually there's a solution for that, and that is an additional option called Medigap, or what many of us see on TV called Medicare Supplemental Insurance. And basically, what this is it's a private insurance that or private companies sell this insurance as basically a gap between what the government is covering and you're paying and what the hospital or doctors ask you to pay. If there's any sort of gap there, think of those major medical expenses that maybe run into the tens or hundreds of thousands of dollars, and you don't have 20% of that to be able to pay. Well, that's where this kind of insurance would kick in. It does not work with Medicare Advantage plans. So remember, I said it almost seems like you do A, B, and D, or you do C. Well, if you do C, you don't need to have this kind of gap insurance. If you do A, B, and or A, B, and D, it probably makes sense to look into this.
Really craving Campbell's alphabet soup. So with that, we'll be right back.
Capital One Auto Navigator does more than just auto financing. We're here to help you find a car you love, too. Shop millions of cars from thousands of dealers nationwide. Research your favorite makes and models. Explore dealers near you and more. All on Auto Navigator.
Thank you again for joining us for another episode of the Queer Money Podcast. This bonus episode, which we wanted to keep short, that's why we didn't go too deep into any one of these. We will go into them individually in future episodes. There is no Queer Money takeaway from this episode, but there are some cool things in this week's newsletter.
Then join us next Tuesday for, wait for it, our last episode of 2024 and the last episode before we head into our 10th calendar year of production.
That's right.
Can you believe that? What an old show.
Mm-hmm.
Until next time, stay fabulous.